Welcome back to Do No Harm, where we fight for patients and against identity politics in healthcare. Podcast hosts Benita Cotton-Orr and Dr. Stanley Goldfarb will highlight the medical industry's most pressing issues and dangerous trends, and discuss how we can achieve a better healthcare system for all.
Stan, how do we change things for the better in healthcare? How do we get rid of this woke approach and go to what you mentioned earlier in one of the podcasts, which is optimal outcomes instead of this equity approach, that equality approach that is being promoted in this in the woke ideology and the woke approach in medical institutions?
Yes. Medical care is not optimal in the United States. We all know that. The federal government many years ago came out with a study from the Institute of Medicine, To Err is Human, to point out that something on the order of, they claimed, 98,000 people a year died in hospitals in the United States because of medical errors of some sort. Some of those medical errors represented the fact that physicians were not performing medicine in an optimal fashion. Some of it was due to communication errors, and various efforts have been instituted in order to improve communications in hospitals. For example, having electronic health records that a physician is able to see whether a patient has had untoward reactions to previous medications to avoid exposing a patient to that medication on a second instance, as an example of what electronic health records can give, or allow physicians to see a long history of patients' laboratory studies to see if there's been a change that may be subtle, but it's slowly developing change over time. And the issue has been to improve healthcare for everyone. If we improve healthcare for everyone, we will improve healthcare for minority patients as well. One example of this, which I encountered recently, had to do with trying to improve maternal mortality. Maternal mortality has been an issue that's been promoted as being evidence of racism in the United States. It's a very complicated and interesting, from the point of view of opportunities to improve things, problem. And it's been at my own institution, the University of Pennsylvania. They sought to do something to improve maternal mortality in Black patients, which is higher than it is in white patients. There's a whole complicated issue about how it's counted. Turns out it's counted in some ways in the United States if a woman dies within a year of delivering a baby, so that automobile accidents, violence, other kinds of issues that may come into play have been counted in some ways of counting the system. But be that as it may, the institution decided it was going to come up with a plan. The plan that they came up with was one that benefited every woman, because one of the issues about maternal mortality was if patients develop a massive hemorrhage at the time that they deliver their baby. They needed to have a system in place which was better at responding to this. And since, for example, in the state of Pennsylvania, far more women die each year who are white women who die during delivery. And in 2018, 19 women died in Pennsylvania out of 139,000 deliveries. So it's a very rare event. But of those 19 women, 3/4 of them were white women. 25% of them were Black women. That's a disproportionate number of Black women given the population of Black women in Pennsylvania. But most of the patients who died were white women. So the best thing one could do is to come up with a plan that would eliminate maternal mortality, not Black maternal mortality, but maternal mortality. And one of the ways that my institution, my former institution, did this was to create a team that would be ready in case there was a woman who was delivering a baby, had a massive hemorrhage. The team included the blood bank people. It included nurses who were specially trained in the problem. It included physicians who were specially trained in the problem, so that they could be called immediately to the bedside when such a problem occurred and be able to treat the patient better. This would improve the health of everyone. It would improve Black mortality. It would improve every woman's mortality risk at the time of delivery. So that's what needs to be done. We need to improve healthcare. We need not to decide we're going to improve Black healthcare. We're going to improve all healthcare. And if in an institution's efforts to improve healthcare, in the Black community involves spending extra money in order to provide better access to the Black community, that's fine. But realize that having a situation where you achieve an improvement in Black healthcare, don't achieve an improvement in overall healthcare, you're not acting in an optimal fashion. You should be trying to improve healthcare for all and expending your resources on the largest number of people and improving healthcare for all individuals. So that sort of initiative would make, I think, much more sense than deciding, well, we're going to improve initiative for the 15% of people that represent a small minority, and we're not going to improve things for anyone else. I don't think that's something the American people would accept, and I think healthcare's goal ought to improve healthcare for everyone.
I think you make a great point. So if you have physicians, you have nurses, you have all these medical professionals, what would you say to them? How do you do it on a one-on-one, one-to-one basis? What can you do?
Yes. And, we've heard a lot from nurses particularly about this, nurses who have been in the field for many years and, again, are told that worse outcomes that have occurred for their Black patients are due to their bias. Many of them have been outraged by this kind of notion and have pushed back. We had one nurse who's actually we work with quite closely who was fired from her job because she was asked to take one of these implicit bias courses and was given an exam at the end of the course and did not answer the questions the way the examiner said was the proper answer to the question. And she was terminated from her position because she refused to answer the question the way they wanted the question answered. They wanted the problem blamed on the physician corps, and she blamed it on some activities that the patients engaged in that contributed to poor outcomes. This was an unacceptable answer, even though in her view this was the correct answer, and it may very well have been the correct answer for her in her experience. So we've had input from individuals like her, and we've supported them as well. And we've given them advice when we could. We've given them support when we could, and we're interested in the response from all healthcare personnel because it is a team effort, often in the delivery of care, and all of these members of the team need to be supported and need to understand that the best way to improve healthcare is to improve healthcare, not to just improve healthcare for one group of individuals.
So what kind of feedback are you getting from people you're helping? Are they finding it easy for others to join in when they speak out?
They're afraid to speak out. I think this fear is palpable. It's real. We even had one physician who realized that we were sending a letter of concern about a scholarship that his institution was offering. And he had been one of our donors and wanted his name stricken from the donor list because he was afraid of retribution. This is un-American. I mean, to have retribution against people because of their political ideas is something that, we eliminated, we thought, back in the McCarthyite era in the United States, back in the 50s when if you believed in leftist causes, you were subjected to losing your job. You were blacklisted if you were a Hollywood producer or writer. We thought those days were gone, and now they're back. And this is of great concern. So if there's one fear that I really have is that this regime of silence that's being forced on the American people, on those who have heterodox ideas, is one that's very dangerous because we need to have a country where people can speak their minds, argue, debate, but be allowed to speak their minds and have freedom of thought. And without freedom of thought, I'm afraid that the American ideal will die.
It's like 1984 all over again.
Yes, right, exactly.
Really disappointing. But Do No Harm is doing great work to turn that around. So it's exciting to see that, and I'm excited to be a part of it.
We're excited to have you as part of it, yes.
Thanks, Stan.